video, we talk about women's mental health and ups and downs at the time of their periods or menstrual cycles. So we have here a very famous athlete, a wrestler, who talks about how her mental health has been impacted by her highs and lows. And very recently, after she lost a bout, she actually came out in the open and told our channel that she was having her periods at that time and she had to go through a very severe regime because of the weight cuts that wrestlers have to do. So given all of that, she lost, and how it impacted her. It had impacted her before also. And in the same video, we also have a nutritionist who kind of relates to these same concerns when she says that women have to monitor their menstrual health, not only those few days when they are having their periods, but through the month, because it's a cycle that has its ups and highs and lows, and it impacts your mental health. So you have to monitor, you have to journal, you have to take supplements, you have to take vitamin B in the days leading up to your period, so that your mental, you stay sane, you stay stable, you can play your sport, you can do every activity as you are supposed to. So please watch here for the doctor and the athlete.
Hello and welcome to this very special conversation as part of this mental health conclave with Meenu Agarwal, clinical nutritionist. She's worked a lot in the sports nutrition field, has worked with celebs, decade-long experience, and today I'm going to talk to her about certain issues which are still considered taboo. Hardly any discussion in the public domain. People need to open up more. Very recently, I've heard Jhulan Goswami talk about period pain, depression. So these are very, very important issues. So as part of this, first question, thank you very much for your time. What is the relationship? I mean, how does one, if you're an athlete, biological, hormonal issues will always be there. How do you overcome during periods when you're playing? How do you overcome depression? What are the If I can ask you for certain guidance, what will you tell my viewers?
Before I would suggest about the guidance, Buri, I would like to explain a little bit what happens, what the woman goes through. As women, we have a monthly hormonal cycle, which we call menstrual cycle. And this menstrual cycle heavily impacts our body system, emotions, and our mood. Every woman goes through one or more of the symptoms of physiological or psychological symptoms like cramps, abdominal pain, heavy abdominal pain or back pain or flooding. At times they go through anxiety and distraction. They have headache, migraine, and they also have this kind of mood swings and the low level of energy, fatigue, and kind of low motivation, and severe bouts of emotional highs and lows.
So what you are saying, do you want more discussion on these things? Do you advocate more discussion on these things in the public domain?
Definitely. This is something still women feel like it's a taboo. They don't feel comfortable to discuss about it. They don't open up. Although almost everyone is suffering with this.
Correct.
There's a recent study done on this particular about athletes' periodical behavior in 2020. University of Sunderland and the West of Scotland has done on female athletes, international female athletes. 15 of them were studied under this. They are all international rugby players. And about 2/3 of them has admitted that they think their training period has gone impacted badly because of this periodic phase. And about half of them admitted that their performance has been impacted because.
So how do you sort of overcome this, or how do you counter this? Because this is going to happen, and it's part of human life. So in the next couple of minutes, can you explain what you advocate? What should athletes do?
First is we need some experts to be there with the women to understand during their training phase what the girl is going through. Because when we say menstrual cycle, it's not 1 or 2 days thing. It's a whole 28 to 30 days cycle, where in different phases impacts differently on a woman's body. Especially injuries are women's body get injury prone during the luteal phase, which is the follicular phase, wherein severe damages to ACL tear or twist and turn and ligaments and those soft tissues get damaged more. So these have been still under more research, but yes, these are seen. And a lot of depression, mood swing, anxiety factor is there. So we need to continuously engage in talking to these girls, understanding their periodic phase. Girls should be motivated to keep a track of their periods on their mobile or any software. There are a lot of softwares available these days. They should keep a track, and not only keep a track, they should also make a note how they feel during those days. Throughout the cycle of those 30 days, how do they feel? Are these few days of severe demotivation, or they are feeling low on energy, or these are the highs and they are having a good
Final question. Is there anything that you can suggest as a nutritionist that people should eat? Should diet change?
Absolutely. Girls should start following, having at least 8 to 10 days before their period starts. They should start having food rich in vitamin B group, which is especially vitamin B6, or it is also known as pyridoxine. Pyridoxine rich foods, I'm just suggesting you, there are lots of cereals like oats, banana, chicken, meat, and pyridoxine is easily available in starchy vegetables like potato and all the under the ground rooty vegetables. They should start having that, and along with pyridoxine, they should also supplement themselves with zinc. Zinc rich foods are easily available. All sorts of beans, nuts, and dairy food are rich in zinc. If anybody is lactose intolerant, I will suggest start supplementing yourself with a good quality supplement which contains pyridoxine and zinc.
I'll end there. So as you have seen, I mean, very fundamental suggestions, but suggestions that can make a very profound impact on this particular issue that is very less addressed. That was Meenu Agarwal. I'll come back with Meenu and address some other important issues which are very little discussed in the public domain. Keep watching this mental health conclave.
मैंने रियो में भी ये फेस किया था, मतलब मैंने फील किया था टोक्यो में, उसके बाद और ज़्यादा फील किया है। बट क्या बोले, मतलब सबका नेचर है, शायद मैं भी कभी ना कभी किसी ना किसी को ऑब्जर्व करती होंगी, तो वो तो एक ह्यूमन नेचर है। तो वो थोड़ा सा अगर चेंज होगा तो एज एथलीट हमारे लिए भी बेटर होता है। एक इन्वायरमेंट हमारे लिए एज एथलीट के लिए कंफर्टेबल रहेगा, तो हम ज़्यादा प्रेशर के साथ में नहीं खेलेंगे। क्योंकि हमारे इंडिया में स्पेशली मैं बोलूँगी कि बहुत जज करते हैं। एक ही कंपटीशन में आपको हीरो बना देंगे, एक ही कंपटीशन में आपको ऐसे बोल देंगे कि नहीं इसको तो कुछ आता ही नहीं है। तो वो मतलब वो लाइन ड्रॉ नहीं करनी चाहिए कभी भी ना। तो उससे मतलब एज ए एथलीट हमारे ऊपर बहुत प्रेशर बिल्ड होता है, क्यों कि अभी अगर इसमें नहीं आया तो फिर बिल्कुल ही आप मतलब ख़त्म हो जाओगे वैसा करके। तो वो प्रेशर बिल्ड नहीं हो एथलीट को, तो एक नॉर्मल वैसे मतलब हाँ ठीक है, हार जीत चलती रहती है, जीत गए कल हारेंगे भी, वो तो ऐसे तो कोई है नहीं। कोई भी महान कितना भी बड़ा एथलीट रहा हो, सभी हारे हैं कहीं ना कहीं एक मोमेंट पे, और हारेंगे तभी हम मतलब बेटर करेंगे क्योंकि एज ए एथलीट हमें बेटर होना है। तो मेरा वो है कि मतलब एक चीज़ से मुझे संतुष्टि मिलती है कि मैं एज ए एथलीट हर कंपटीशन में हर साल जितने भी सेटबैक आ रहे हैं या मैं मेडल जीत रही हूँ, तो उसे मैं एज ए एथलीट बेटर निकल के आ रही हूँ, मेंटली भी, फिजिकली भी, इमोशनली भी। तो वो एक ग्रोथ मैं अपने आप को एज ए एथलीट अभी मतलब एक उस ग्रोथ को मैं इंजॉय करने की कोशिश कर रही हूँ।